Chlamydia. What is really chlamydia? The word itself might sound unfamiliar, but the impact of this infection is a stark reality for millions across the globe. Chlamydia, it's not just a health issue, it's a social issue that affects communities and families. It's a silent epidemic, often lurking undetected and wreaking havoc on reproductive health. Many people are unaware they are even infected, which allows the disease to spread more easily. This stealthy infection is one of the most common sexually transmitted infections worldwide, affecting people of all ages, genders, and backgrounds, and its impact can be devastating if left untreated. Untreated chlamydia can lead to severe health complications, including infertility and chronic pain. But knowledge is power, and understanding chlamydia is the first step toward protecting yourself and your loved ones. Educating yourself about the symptoms, risks, and treatments can make a significant difference. Chlamydia thrives on silence, often showing no symptoms in its early stages. This silent nature makes it particularly dangerous, as people may unknowingly spread the infection. This makes regular testing and open communication about sexual health absolutely critical. Regular screenings can catch the infection early, making treatment simpler and more effective. We need to break the stigma surrounding STIs and create an environment where seeking help and information is encouraged and normalized. Open dialogue can lead to better health outcomes for everyone. By shining a light on this silent threat, we can empower individuals to prioritize their sexual health and well-being. Together, we can combat this epidemic and foster a healthier future for all. Chlamydia is caused by the bacterium Chlamydia trachomatis, a microscopic organism that can wreak havoc on the human body. This bacterium infects the cells lining the reproductive tract, including the cervix, urethra, rectum, and even the eyes, making it a versatile and dangerous pathogen. What makes chlamydia particularly dangerous is its tendency to fly under the radar, often going unnoticed until significant damage has been done. Most people infected with chlamydia experience no noticeable symptoms, especially in the early stages, which means they can unknowingly spread the infection to others. This means the infection can linger for months or even years, silently causing damage without raising any alarm bells, making early detection and treatment crucial. The absence of symptoms doesn't mean the absence of risk. In fact, the silent nature of chlamydia makes it even more insidious. Untreated chlamydia can have serious long-term consequences, particularly for women who may face severe reproductive health issues. It can lead to pelvic inflammatory disease, a painful condition that can scar the fallopian tubes and increase the risk of ectopic pregnancy and infertility, affecting a woman's ability to conceive. In men, untreated chlamydia can cause epididymitis, an inflammation of the testicles that can also lead to infertility, highlighting the importance of early diagnosis and treatment for both genders. Chlamydia spreads through unprotected sexual contact with an infected individual. This includes vaginal, anal, and oral sex. It's important to remember that even if your partner doesn't show any symptoms, they could still be infected and transmit the bacteria. The risk of infection increases with the number of sexual partners you have. It's crucial to understand that chlamydia is not spread through casual contact. You cannot get chlamydia from sharing toilets, hugging, kissing, or using the same utensils as an infected person. The bacteria can only be transmitted through sexual contact. Knowing how chlamydia is spread empowers us to make informed decisions about our sexual health. The importance of early detection. Regular testing is the cornerstone of chlamydia prevention and control. Since chlamydia often doesn't present any symptoms, regular screening is the only way to know for sure if you're infected. It's recommended that sexually active individuals, especially women under the age of 25, get tested for chlamydia at least once a year. Testing for chlamydia is simple and painless. It typically involves providing a urine sample or a swab of the affected area. Results are usually available within a few days. Open communication with your healthcare provider is essential. Be honest about your sexual history and any concerns you might have. Remember, early detection is key to preventing the long-term consequences of untreated chlamydia. The long shadow of untreated chlamydia. Untreated chlamydia can cast a long shadow on both physical and emotional well-being. For women, the complications can be particularly severe. Pelvic inflammatory disease, or PID, is a serious concern, causing chronic pelvic pain, ectopic pregnancies, where the fertilized egg implants outside the uterus, and infertility. The emotional toll of infertility can be devastating for individuals and couples hoping to start a family. In men, untreated chlamydia can lead to epididymitis, a painful inflammation of the epididymis, the coiled tube that carries sperm. Epididymitis can also lead to infertility if left untreated. While chlamydia is often associated with reproductive health issues, it's important to remember that it can also increase the risk of other STIs, including HIV. Hope on the horizon, treatment and prevention. The good news is that chlamydia is easily treatable with antibiotics. These medications are highly effective and can clear the infection in a short period of time. A course of antibiotics, usually taken orally, is highly effective in clearing the infection. The most commonly prescribed antibiotics for chlamydia are azithromycin and doxycycline. It's crucial to complete the entire course of antibiotics as prescribed by your doctor, even if your symptoms improve before you finish all the medication. Stopping the medication early can result in the infection not being fully treated. This ensures that the infection is completely eradicated. Follow-up testing may be recommended to confirm that the infection has been fully cleared. Prevention is always better than cure, and when it comes to chlamydia, practicing safe sex is paramount. This includes using barrier methods like condoms during every sexual encounter. Using condoms consistently and correctly during sexual activity significantly reduces the risk of transmission. It's important to use a new condom for each act of intercourse. Limiting the number of sexual partners you have can also lower your risk of infection. Being in a mutually monogamous relationship with a partner who is tested negative for STIs is another effective strategy. Regular testing and open communication with your partner are essential for staying safe and healthy. If you or your partner have any symptoms or concerns, seek medical advice promptly to ensure early detection and treatment. Taking charge of your sexual health. Taking charge of your sexual health is an act of self-care and empowerment. It's about making informed decisions that protect your well-being and that of your partner. Regular testing, open communication with your healthcare provider, and practicing safe sex are the cornerstones of sexual health. Remember, knowledge is power. The more you know about chlamydia and other STIs, the better equipped you are to protect yourself and others. Don't be afraid to ask questions, seek help, and prioritize your sexual health. By breaking the silence surrounding STIs, we can create a healthier and happier world for everyone.